And as Vice Chair Keeler heads up, she moves House File 3469 to bring that before the committee. And there is an amendment to the bill. And I'm thinking, Representative Keeler, that maybe we do the author's amendment just to kind of get the bill, do that right away, get the bill in the shape that you wish, if that's okay with you. We'll get everything. No problem. We'll get everything settled. So, Vice Chair Keeler, would you like to move the A1 amendment to get the bill in shape, and then we'll move on with the bill?
Sure. Can I talk about the amendment?
Of course. Yeah, please. Yeah, totally. Yeah. So, you are moving the A1 amendment.
Correct.
Okay. Then please, talk about it.
Thank you, Chair. And we're handing out a couple information sheets. With yesterday being a holiday, some people didn't get to us until this morning. So now there's more information for you to follow along with us. So the amendment that you have in front of us is a combination of some of the updates that we got back from the agency, because one thing that we've learned, or that I've learned in my time here, is working in hand with agencies to make sure implementation is actually feasible and somewhat acceptable to do. So that's what that amendment is. And then this also got the counties a little bit more on board with us, adding the community navigators piece to it, because sometimes the counties are already stretched very thin. This would have an opportunity to have some support in the community to do that work. And so with the amendment, it's putting it in the shape that both the agencies and the counties prefer, which we like teamwork in this space. Thank you, Chair.
Thank you so much, Vice Chair Keeler. And members, are there questions about the amendment? I know that we've gone right straight to the amendment, just figuring it makes sense to get the bill in that shape that works for the agencies and the counties and the bill author. Any questions at all anybody has on the amendment? I am seeing none. So all in favor of approval of the author's amendment, the A1, please say aye. Aye. Any opposed? Okay, so that motion passes. The bill is amended. And House File 3469, as amended, is before us. Representative Keeler, please proceed.
Thank you, Mr. Chair and members. Good morning. Just want to say on the record, I want to be invited to the farm too.
What's your position on the farm bill? That's what Representative Nelson wants to know. Continue.
Yeah, but from teachings that I had from early in my life to growing up, it matters what we put in our body. Food is medicine. As a holistic individual, I know that what I put in my body actually impacts the outcomes of our health. We know that studies tell us that food insecure households spend almost 45% more on healthcare costs than families that have food secure homes. If you know, like I struggle from migraines on a regular basis, and if I put junk in my body one day, the next day I feel it, right? And you know, healthy food tends to cost more. People say that often if you have food insecurities or tight budgets, you shop in the middle of the grocery store because that's where you find the packaged meat or the packaged meals versus produce is usually more expensive. Meats is more expensive. My salmon is ridiculously expensive on most days. And so what this bill does is it creates an idea that SNAP is medicine. The food that we put in our body is the medicine that helps us, which then has reduced outcomes in the healthcare sector. So crossing paths in that way I think is really important. With the federal government and the current status of the SNAP program, almost 6,000 Minnesotans who are adults aged 18 to 54 without dependents have lost their access to this, to SNAP or to food access. And 6,000 is 6,000 too many in my mind in Minnesota. And so what this bill does is it does create an adjustment. It's a state-funded program that would allow these individuals to receive $175 worth of food benefits in our state. It is a pilot program. It's a 2-year program, hoping that the feds can pull it together and get the SNAP program back and up and working. But in that time, what this bill does is hopefully fills those gaps. It is scalable. In the information that we passed out, you'll see per county, these are the numbers of individuals just in the last 2 months who have actually lost their SNAP benefits. And so you can see your own county where you stand and some of the surrounding counties. But with the county the county breakdown in different populations, we do feel this could be scalable if this is something that we move forward with this year. With that, Mr. Chair, I'll move to my testifiers.
Thank you. And so first testifier, Jessica Webster, please identify yourself, share pronouns if you're comfortable, and proceed.
Thank you, Mr. Chair, members of the committee. My name is Jessica Webster, she, her. I'm a staff attorney with Legal Aid. And right out of the gate, Mr. Chair, thank you for hearing this bill about adults ages 18 to 54 who've lost SNAP benefits under federal time limits. In my 18 years with legal aid, this has been a very difficult group to get attention and empathy for, frankly. I think as a society, we're having more thoughtful conversations about disabilities, also about mental illness, addiction, homelessness, trauma. I know this committee is really well versed in ACEs scores. These things are all present in this population of adults. And what we don't always talk about is how those challenges show up to affect employability and work. And the quiet part out loud is that employers aren't always clamoring to hire these folks full-time or getting as many hours as they need to be able to access SNAP under federal requirements. Unfortunately, Congress has created a very blunt tool with federal time limits for these adults who are asking for help with food. And federal law cuts people off without really requiring a thorough conversation about what's going on in their lives. And there's not really much of an evaluation before food gets cut off, before this entitlement gets cut off. We now have more than 2 decades of evidence that show that these time limits are not improving employment outcomes. I think depending on your perch, people look at these time limits as either punishing folks who aren't meeting enough work hours or as trying to motivate folks to meet work hours. And really, neither of those things are bearing out. What we do have in Minnesota is a very recent Johns Hopkins study that looked at our Medicaid population and looked at single adults who have become disconnected from food and how sick they are, that they're dealing with chronic health problems, untreated conditions related to their disabilities, and other health issues and expenses. So we're grateful to Representative Keeler for bringing this bill forward. It's not a permanent solution. It's a temporary pilot. As she said, it's scalable due to budget constraints. I'm sure we won't be able to serve all 6,000 adults, but we do think it's a good start. We support the bill, and we appreciate that she brought it.
And thank you for your testimony, for your work. One clarification, Ms. Webster, you were mentioning the time limits. Can you give us a sense as to just sort of what sorts of time limits apply? If you can, just a little more detail on that, if you can.
Thank you, Mr. Chair. So the federal time limits, which have gotten a little more aggressive in the last few years, are an adult can get SNAP benefits 3 months out of every 3 years if they're not meeting a 20-hour-a-week work requirement, or if they're not eligible for an exemption. And the reason that this bill is so relevant is that legal aid and other advocates actually believe there are a tremendous number of people in this 6,000 that are eligible for exemptions. We just think we need to connect with them and help them reconnect to SNAP benefits by getting a current doctor's statement, a current mental health evaluation, a statement from that they are homeless, a statement of their veteran status. Oh. Those are the types of things that we could help people get reconnected to federal benefits on.
And so there can be exemptions to those time limits, but the way that they're structured, the thinking is there's plenty of people in there who could qualify. They just haven't been able to get that support.
Thank you, Mr. Chair. That's accurate.
Okay, good. Thank you so much. We'll move to the other testifiers, and then discussion of Lisa Lane and Peter Wojtak, I think, are the other two we have. I think Ms. Walsh will not be testifying on this bill. So Lisa Lane, make your way on up. Thanks so much to Jessica Webster. And once you settle yourself in, please identify yourself, proceed.
Thank you very much, Mr. Chair, and thank you for the opportunity to present to you in support of House File 3469. My name is Lisa Lane, and I am the Director of Public Policy at Open Arms of Minnesota, a food as medicine organization. For nearly 40 years, Open Arms has been preparing and delivering healthy, nourishing, and made-from-scratch meals to vulnerable, sick, and food insecure Minnesotans, with the help of 4,000-plus volunteers who help make meals from scratch in our 2 kitchens, one in the East Phillips neighborhood and of South Minneapolis, and our newest kitchen on the west side of St. Paul. We prepare nearly 2 million meals per year, and we deliver and ship those meals to thousands of Minnesotans who are living with critical and chronic illness. Our team of registered dietitians and trained chefs work together with our team of client service staff and client healthcare providers to develop and prepare our nutritious meals. We know that healthy nutrition makes a difference. According to the Journal of Urban Health, when individuals received regular nutritious meals, they also experienced decreased depressive symptoms and decreased binge drinking. Further, research from Tufts University unequivocally states that access to healthy food improves health outcomes in general, including a 70% drop in emergency room visits and a 50% decrease in hospitalizations overall. resulting in a $13.6 billion savings for our healthcare systems. We support SNAP as medicine because we have seen firsthand the impact of food as medicine to increase healthy outcomes, especially to serve vulnerable adults who are at a significant risk of hunger and malnourishment. SNAP as medicine is a compassionate and pragmatic approach to addressing the holistic well-being of at-risk populations. At Open Arms, we have learned that chronic health conditions, whether mental or physical, often impact various aspects of an individual's life, including their ability to maintain stable employment and financial security. Access to SNAP as medicine can provide crucial assistance in ensuring access to nutritious food, which in turn can positively influence health outcomes. Adequate nutrition plays a pivotal role in mood regulation and cognitive function. Furthermore, promoting access to meals through this legislation supports is a comprehensive approach to mental health care, recognizing that physical and mental well-being are intricately connected. Support of SNAP as medicine extends and underscores the importance of addressing the multifaceted needs of individuals to enhance their overall quality of life and facilitate their journey towards mental and physical wellness. Investing in nutritious food now helps reduce hospital visits, and it saves money. It provides hope and comfort for a group of people who are often forgotten or left behind. It is not overstating to tell you that healthy meals comprised of good nutrition really does save lives. On behalf of all of our clients, our staff dedicated to serving them, and our volunteers who give their time, thank you for your time and consideration of House File 3469.
Thank you. Thanks for your testimony and for your work. And I think there was one other person, Matt Freeman. I'm sorry, no, Peter Wojtak. I'm sorry. That'll be after that. Mr. Freeman will, but Peter Wojtak, will have you back on up. And then you've introduced yourself previously, so you can just dive on in with your testimony.
Thank you, Mr. Chair. Here to testify in support of House File 3469. And so just want to say SNAP is really our most effective tool to fight hunger in the state. It provides targeted assistance to very low-income individuals and families and key vulnerable populations who rely on nutritious foods to keep them healthy. It also lifts people out of poverty and relieves pressure on the overwhelmed emergency food system, which we know are doing all they can to try and meet the needs growing across the state. And because we operate the Minnesota Helpline at Hunger Solutions Minnesota, we know that navigating the SNAP application process can be hard and keeping benefits can be harder. So even if someone is likely on top of deadlines and paperwork, it can be a struggle. Missing a mailing could mean you lose benefits and get cut off and have to start all over again. So one of the challenges that we see with people, especially the time-limited SNAP population, is they aren't always in the most stable of housing situations and tend to move more than the general population, so they can miss the mailing a little bit easier. And so that's why it's so important to have that friendly voice on the phone explaining and confirming the information in the letter. But for many time-limited recipients, it can be difficult, like Jess said, to navigate that system to meet those exemptions, especially for those who face challenges from homelessness, addiction, mental health access, and access to transportation. So this is why we feel it's really important to restore SNAP benefits to those Minnesotans who lost food support due to the federal time limits, and to help make sure they're able to put food on the table during this difficult time. So thank you for your consideration and support of the issue.
Thank you so much. Thank you. And then Matt Freeman, I think, is our last testifier. And so once you settle in, identify yourself, share pronouns if you're comfortable with that, and proceed.
He, him. Chair Pinto, Matt Freeman, thank you, committee. Here on behalf of the Minnesota Association of County Social Service Administrators and the Association of Minnesota Counties, here to share comments on the SNAP as Medicine program. I want to start out just by thanking Chair Pinto, Vice Chair Keeler, for dedicating an entire hearing to this issue of food insecurity and many approaches to addressing it in our state and in our communities. On a personal note, SNAP is close to my heart. It's something my grandfather worked hard on in the 50s and 60s as well. Counties support ensuring access to SNAP and for all eligible Minnesotans. And counties know that continuity and access to SNAP will help low-income Minnesotans achieve economic stability. We appreciate that the advocates working on this legislation have solicited county input, and given the holiday, we haven't been able to go through the current amendment, but we believe that the changes were made with the intent to make this legislation more workable for state and for counties, and we greatly appreciate that. Counties seek to ensure the processes and procedures outlined in the bill are feasible for counties to enact so that the potential benefits would really be realized by those receiving benefits, and it appears that those updates are being included. We look forward to continuing to work on this with advocates and Representative Keeler, and thank you so much.
Thank you. Thank you, Mr. Freeman. Anybody else who wishes to testify on this bill? We'll find that out first. Not seeing anybody. And so we can move to member questions and discussion. Representative Perez-Vega.
Thank you, Mr. Chair. Thank you, Representative Keeler. I just want to address how important HF 3469 is as somebody who has a chronic illness and thinks of so many of my constituents who speak with me who don't get the required support for the food that keeps them alive. And food is medicine. It's just as important as we need our clean water that folks need access. And with what we've seen in our prior research with Hunger in Minnesota, this great display of showcasing the need and the importance that we need to do better in Minnesota to address that food is medicine. It's a livelihood. It's not just filling up and saying, hey guys, there's a little bit of food on this end. Some folks really need to actually have food to make sure that they can wake up in the morning a little bit more than everyone else. And this here addresses that. So thank you for making sure that folks know that food is medicine. SNAP is. Thank you.
Thank you, Representative Perez-Vega. Representative Hicks.
Representative Keeler, thank you so much for this bill. As your testifiers were talking, I was taken back to my days as a baby little community worker. And I was supporting a young man who was a senior in high school. He had turned 18 and his mom had kicked him out. And the school had referred him to me because he was on an IEP for independent living skills. And I was like 24 and knew nothing. And he was on SNAP. And I didn't understand that there were federal work requirements and that SNAP was going to end so quickly. And it ended, and he had no food. He was working with vocational rehabilitation, but his family had never connected him with social services, and he had a developmental disability, but his IQ was out of date for the requirements that the county was requiring because it hadn't been done since he was 9. And his IQ was like 60. And so he was moderately developmentally delayed, and he was now homeless, didn't have the right documentation to extend his SNAP. Because he was a single male with no children, he wasn't eligible for any financial support. He was couch hopping. And I distinctly remember, leaving one day after he was at a friend's house, and sitting in my car, shutting the door, and just sobbing. Because it made no sense to me that this young man who had done nothing wrong was getting no support because he didn't know how to navigate a system. And now we were starving him on top of everything else. And I will never forget that young man. And this program fixes that for young people like him and for other people. And so I just want to say thank you so much for bringing this bill, because until you've had to navigate the system of getting the right piece of paper, the right documentation, the right whatever, you don't understand how difficult that process is. And so thank you for this, and thank you for the amendment to include those navigators. I think that's really an important part, and I'm grateful that you've been able to collaborate with folks to bring this forward. Thank you.
Thank you, Representative Hicks. Representative Coltner.
Excuse me. Thank you, Mr. Chair. And I want to echo all of my colleagues' comments and thank Representative Keeler for bringing forward this bill. And I think what really strikes me is I think this is another opportunity for us to really show how food insecurity, and in particular this issue of SNAP case closures due to time limits, really is a statewide issue. It is not unique to any community in our state. I did the math, and of these case closures by county, about 40% come from Greater Minnesota. And that's about the proportion of the population of the state that lives in Greater Minnesota. So the idea that for example, this might be overrepresented in the metro is simply not true. But the number that jumped out to me was the number from my own county, Hennepin County, where something like close to 40% of these case closures come from. And the reason I bring this up is because I I think there is a very popular misconception that Hennepin County is so heavily dominated by Minneapolis. And the reality is that 2/3 of Hennepin County is suburbs. It's not Minneapolis. It's communities like mine and Representative Katiza-Tunes. And even if those numbers are over-representative of Minneapolis, we're still looking at something like a fourth or a fifth of these overall case closures coming from Hennepin County suburbs. And so I think it is just important to recognize that, and I do hope this moves forward, that this program will serve everyone in the state. It will serve everyone in every single one of our communities and make life just a little bit easier, a little bit better for folks in all of our communities. And that, I think, is just something that we really need to make sure we're focusing on. Thank you.
Thank you so much. Looking to see any other questions. Representative Davis.
Thank you, Mr. Chair. Thank you, Representative Keeler. I want to make sure I understand what the purpose of this program is for. It's so that people who already are eligible for SNAP have access or more access to healthy food to help benefit their mental health, correct?
I think that's not quite right. Representative Keeler or Ms. Webster, either one. Vice Chair Keeler, looks like you're going for it.
Thanks, Chair. Thanks, Representative. I think it's more than just mental health. I think it's overall health as a whole. I mean, we know, and yes, a lot of them are eligible. They maybe just don't have the resources to complete the right steps. That's why the community navigators are going to be so important. Because we know, and I can let my testifier add a little bit more, but in the work that we do in the community, we know a lot of these individuals would be eligible because of their homelessness status or veteran status or disability or illness status. And so I would say it's more than just mental health. I look at it more as like our holistic health. So it's mental health, mental, spiritual, emotional, and physical all together is better. And also when you look at it from more of an investment lane, because as I said at the beginning, when we invest in food, it actually has a pretty significant reduction in our healthcare costs. So just kind of moving that if we help individuals have healthy food, they would have overall better healthcare outcomes. But I'll let my testifier answer more.
Ms.
Thank
Webster.
you.
Thank you, Mr. Chair. Ms. Webster.
Mr. Chair, Representative, I think just the clarification is income eligible. So these are low-income folks who would be income eligible, but they've lost SNAP due to this federal time limit rule. And you know, in legal aid's work, when folks get to us and they say, you know, I just lost SNAP due to the federal time limit, legal aid is often able to get them reconnected because of a barrier or a challenge. It's very rare that we have someone come in who is completely able to work full-time and is not working full-time and just wants to get SNAP benefits. That's not our experience. Our experience is folks have some barriers to employment. We're able to identify what those are. They're homeless, they're precariously housed, they're ill, and we can help them reconnect to federal SNAP benefits, which would not be a cost to the state. It would be reconnecting them to federal benefits. But in the meantime, there would be this bridge of a state benefit.
Representative Davis.
Thank you for the clarification. Yeah, and I guess as I'm reading through the bill, when I did catch that when I see health outcomes, I kept thinking mental health for some reason. But yeah, so it's clearly right there. So the way this is laid out, it'll be provided at $175 per month for the purpose of people getting access to healthy food, correct? Again, I just want to make sure I'm understanding.
Make sure I understand. Ms. Webster.
Mr. Chair, Representative, it would be for SNAP access, to have SNAP benefits to be able to purchase food.
Representative Davis. And maybe I'll just, and is that the amount of a federal SNAP benefit, $175, Ms. Webster? Or?
Mr. Chair, it's actually a reduced benefit.
That's
We
less.
scaled it down a little bit.
Okay, Representative Davis.
Okay, and again, forgive me if I'm misunderstanding, but I just want to make sure I understand this. So when I read the bill and I read these other notes here, the focus is on health, improving my health. And I'm just wondering, I'll just get the question out there. How do we make sure that there's accountability with, hey, they're actually purchasing food that's healthy for them when it comes to this benefit?
That may kind of go to the structure of SNAP to begin with. Ms. Webster.
Mr. Chair, there is no requirement in this bill right now on restrictions on what type of food you purchase in the store. And I think the conversation about inflation, particularly is part of that, in that if we restricted that you could only purchase fruits and vegetables and meat and these things, your benefit wouldn't go as far, frankly. And so if we wanted to have a conversation about, how to bolster some of the healthy components of it, I think there are other pieces of legislation around market bucks and other programs that are really incentivizing and bolstering the healthy food purchases within SNAP. But this one is to make sure people just have food, just access to food, a SNAP benefit.
And can I just clarify, Ms. Webster, the restrictions under this program are the same, or the setup is the same as under federal SNAP, right? So it's the same restrictions or lack thereof.
Mr. Chair, that's correct. Thank you.
Representative Davis, back to you.
Thank you. I get it. So another question for you. Our caseworkers at the county are already overloaded big time. Like, is this bill taking into any consideration? We're going to be putting a heavier load on caseworkers. Is there a cost involved? Is that considered in the bill as well as we're working through this? Like, what if counties have to hire more caseworkers? Like, are we taking into consideration money that will need to be spent there? Does that make sense, that question?
Looking to Vice Chair Keeler, I think, or Ms. Webster, either one. Ms. Webster.
Thank you, Mr. Chair. We were sensitive to that in this bill. So right now, DHS has asked counties to make sure that folks who are eligible for federal SNAP, that they look at some things before they closed folks. I think DHS has actually done a rather heroic job of trying to work with counties, and some counties have done a heroic job in trying to keep people connected. But right now, the piece that you see about the community navigator is the piece where we wanted to be sensitive to county workload on this, and we're hoping that counties could work with legal aid, Hunger Solutions, Second Harvest. We are not funded in the bill, but we do SNAP outreach, and we're pretty good at helping people get connected to SNAP benefits. And so that is the piece where we wanted to recognize county workloads.
And I'll note Mr. Freeman represents county social workers and social service administrators, and he did testify in favor. So, Representative Davis, and then we've got another bill to get to, so we do need to keep moving. Representative Davis.
Yep.
Yeah.
Again, Mr. Chair, thank you. We're laying this over.
We are,
so
yeah.
We're going to continue to
There'll
work
be other
through this
conversations.
and figure out costs. I would just like to bring that up, that we really need to think hard about what extra costs can be incurred at a county level. Thank you, Mr. Chair.
Thank you, Representative Davis. Yeah, we'll be coming back up. I think we've got Representative Katiza-Wattoon, real quick if you can, and then we'll go to Lee Daniels, and then, of course, the author.
Thank you, Mr. Chair. And Vice Chair Keeler, thank you so much for bringing this forward. I personally believe in the old idiom of an ounce of prevention is worth a pound of cure. And I think that many of the issues that we consider in front of this committee are part of that, right? We look at what the state is spending on healthcare costs for publicly funded programs and for folks who can't afford or don't have an employer-based program. People who are eligible for SNAP or who are food insecure, they spend 45% more on healthcare costs every year than food secure households. So I think if we just look at that one piece and we're making this investment and we're ensuring that people can get the nutrition that they need and don't have hungry bellies and can go on to school to actually learn. Like, now kids get food at school and they can actually learn and they can go to work and they can, go on to be positively contributing members of society because they're not worrying about where their next meal is going to come from. That impacts the other places that we're already spending this money. And I think that it's really critical to consider some of the different levers that we can pull and make sure that people are getting the support that they need so that in return, down the line, they're able to give back in a different way.
Thank you, Representative Katiza-Wattoon. Lee Daniels, want to go briefly on this one? Do you want to do the two of them at the end, or how do you represent Lee Daniels?
Let Representative Zlinsegard do my closing.
Oh, okay. Representative Zlinsegard.
She's got a good point.
Okay, Representative Zlinsegard.
Thank you, Chair, and thank you, Rep. Keeler. I appreciate the bills that both Representative Hicks and Representative Keeler have brought forth today. I know that you're both passionate on serving people with disabilities, and I've spent my life caring for the same group the last 40 years. And so to the point, there's a few points I want to make, but to the point of how complicated the processes are in government for applications is very true. And so many times, my experience has been people just don't have the knowledge and they don't have the resources of connections to even know what to fill out. So one of the things that I think, and I like the navigator piece of this, one of the things that I think is critical that we look at is the 175 a month is a piece of this, and then we have the issues going on where we have boarding in the hospital ERs. I was just on a conference call yesterday, as many of you were, and I see it. I've been a patient in the hospitals, and I've also been in this capacity and also in healthcare for 40 years. And so I think it's really critical that we look at what's happening in our state, because we have mental health. We have 40% increase in mental health since the pandemic. We have the stopping of pandemic benefits. And so we have this new level we have to create. And so my thing I'm looking at is just what are the partnerships between the counties to assess and to identify what the needs are, whether it's veteran benefits, mental health benefits, diagnostic levels. What are we doing to reach the people? We have food shelf areas. Most of us, I think we all voted to support the food shelf and how critical it is here. But the reality is we do have a low unemployment, but we have the highest need. And so we have an issue going on in the state that we have to address. And so we have to find ways to reach the people. I do see that the current mental health evaluations and these untreated situations, and then, you know, emergency rooms have a lot of data. Who's continually coming through the emergency rooms that are, if they're serving all people for whatever reason they come in. And so if you ask nurses, they'll say there's sometimes people are coming in because they're hungry, you know? Yeah. So that's a highest cost access in those situations, or mental health screening or behavioral health. And my second comment is that we are losing behavioral health beds across the state at a rapid pace. And we are shipping kids to Fargo as we sit at this committee right now talking about children. We do not have enough behavioral health beds in the state. And so as we're looking at issues for children and adults, I think the emergency rooms and the hospitals and the providers have a lot of data, and we have to look at this whole piece. I do see a pathway that there's probably benefits.
We need to wrap up really quick, just 'cause we have another whole bill to do.
There's probably many of these benefits that they would be federally eligible for if they were getting the screenings timely. And some of those costs shouldn't be at the state, but we don't have the systems in place, so we have to be collaborating between our state government programs better and more efficiently. And they won't fall through the gaps as much as they have been. And so I appreciate the initiative. I think we just need to look at the whole big picture.
Thank you so much, Representative Zalesnikar. Turning to Vice Chair Keeler for final comments on this bill.
Thank you, Chair and members. And thank you, Representative Zalesnikar, for giving me the opportunity to plug the fact that most of our kids go to Fargo. And so that's why one of the bills we're working on is a psychiatric residential treatment facility in Clay County, so that we can actually keep kids in Minnesota to house them, work on the supports that they need within our state. So thank you for giving me the opportunity to plug that, because we do understand this is a very widespread issue. At the end of the day, though, I said it over and over last year, when we're hungry, we're hangry, and I'm pretty sure all of you had breakfast or at least know where you're going to eat lunch or have a dinner plan in mind. And when you don't have that, it is hard to be the best person that you can be and show up, be the best that you can for yourself, for your family, and your community. So thank you for the robust discussion, and continue to look forward how we can feed Minnesota. Thank you.
Thank you so much, Vice Chair Keeler. Thank you, Ms. Webster, for a really powerful bill and a good conversation about it.